A very good morning, sir. Alapati. Hello. Am I audible?
Yes, Kalyan, you are audible.
Sir, you are in mute, sir. Vijay Chan, sir, you are in mute.
Yeah.
No, sir, not audible. I'm sorry.
Now? Hello? Am I audible right now?
Yes, sir, audible, sir. Yes,
You
sir.
are audible.
Yeah. Thank you.
So,
I have one request. Please don't call me with the suffix of sir and all.
okay, a very good morning to one and all. On behalf of Chebrol Hanmaya Institute of Pharmaceutical Sciences, I wholeheartedly welcome all the esteemed delegates who joined this platform to take part in this 1 week faculty development program with the title From Practice to Research, a faculty development program for next generation pharmacists. It is organized by Department of Pharmacy Practice of Chebrol Hanmaya Institute of Pharmaceutical Sciences. It is a great pleasure to organize such faculty development workshops where during the next 1 week we have speakers from different modes of working experiences, from research, from industry, and also from academia, where they are taking this platform to empower the concept of research in pharmaceutical education. So I'm very happy to say that this is the inauguration of the 1 week faculty development program. And on this very important occasion, I request our principal, Dr. S. Vidyadhara, to please give a few insights to this workshop as an introductory note. Sir, please.
Thank you, Dr. Raghu Kalyan. Very good morning to everyone. It gives me immense pleasure to invite all the delegates and the resource persons who have accepted our invitation to be a part of this 1 week faculty development program on the title Practice to Research, Faculty Development for the Next Gen Pharmacies. No doubt, this is a very thirst topic where the pharmacy practice is changing from the simple dispensing to the active participation in clinical care, research, and healthcare innovations. So, this is the time where our teachers need to upgrade ourselves in these particular clinical care, research, and healthcare innovations apart from the traditional dispensing and formulation development and other things. So we thought on behalf of our Chebrol Hanmay Institute of Pharmaceutical Sciences, our pharmacy practice department has came forward to organize a valuable faculty development program on this particular very right topic, that is practice to research for the next gen pharmacies. So as educators, it is our responsibility to prepare our students for these evolving roles, and such programs helps us to stay updated with new skills, methodologies, and perspectives. We are truly honored to have distinguished personalities as speakers from leading academic as well as research institutions. Today, we are having Mr. Vijay Chand Alapati from Parexel International, Hyderabad, who is going to deliver a talk on this particular, the current topics on this particular practice to research. And likewise, Dr. Sonal Sekar from Manipal College of Pharmaceutical Sciences, Dr. Srikanth M. JSS College of Pharmacy, Mysore, Dr. Girish Tunga, Manipal College of Pharmaceutical Sciences, Dr. Krishna Undela, Naipar Gauhati, and Dr. Anjan Kumar, Aikviva Bangalore, are the resource persons who have accepted our invitation to be a part of this faculty development program. My immense thanks to all the resource persons who have accepted immediately for our proposed practice faculty development program and be a part of this, and to share their valuable thoughts in this particular practice to research the next gen pharmacist. So each of these sessions has been thoughtfully designed to provide practical perspectives and stimulate academic curiosity. I once again congratulate the Department of Pharmacy Practice for organizing this meaningful academic event and for creating a platform for connect experts from practice, research, and education. I encourage all the participants to actively engage, learn, and translate these learnings into your teaching and research practices. I wish the program a great success. I once again cordially welcome Mr. Vijay Chand Alapati for today's session and be a part of this. Wholeheartedly welcome you,
Thank you.
Mr.
So
Vijay
much.
Chand Alapati,
Yeah.
for this August occasion. Thank you, one and all, for giving me this opportunity, and all the best for all the participants who are going to participate in this and learn the things which are highly needed at this present scenario. Thank you.
Thank you, sir. I once again thank Chevrolet Hanma Institute of Pharmaceutical Sciences and our principal, Dr. S. Vidyadhara, for constantly putting forward his efforts and encouraging us to conduct meaningful sessions like this for all the professionals at pharma. Now, I would like to take a small moment to introduce the speaker of today's session, Mr. Vijay Chand Alapati. He is currently the project lead at Parexel International under the Department of Pharmacovigilance. He completed his Masters in Pharmacology from JSS University, Mysore in the year 2011, Bachelor's of Pharmacy from Rajiv Gandhi University of Health Sciences, Bangalore, 2008. He had a certification program under the title Principles of Clinical Pharmacology from National Institute of Health, USA in the year 2011, and an online certification course on clinical research training from National Institute of Health, USA in the year 2008. He's an experienced pharmacovigilance professional, skilled in project and KPI development, driving strategic initiatives through data analysis, reporting, and visualization. He has the soft skills of safety management, pharmacovigilance, clinical research, literature screening, training management, quality assurance, project management, and many other titles to his name. To briefly mention some of his achievements, he is a lead and managed 18 plus clinical trial projects ensuring timely delivery, quality, and client satisfaction, provide oversight for medical monitoring and pharmacovigilance activities, including safety data review. He developed and maintained safety management plans, medical monitoring plans, and also procedural documents. And I hope he will be talking about all these things in his detailed session. And he has also utilized systems such as EDC, RAVE, and other Argus safety databases for pharmacovigilance. He is support and managed at internal department of audits, external client audits, and EMEA inspections, which is a very important European body regulating medical resources, and also ensuring compliance and implementation of corrective actions regarding the regulatory affairs. With this very small biodata, I wholeheartedly invite Vijay Chand Alapati sir again to our platform, and I once again thank him for accepting our invitation on behalf of our institute, and I hand over the platform to him so that he can continue with the session. So once again, I thank you and I welcome you. Please take over the session.
Yeah. First of all, I'm audible, right?
Yes, sir, audible.
I think I'm sharing my screen. So can you see my screen?
Yes, sir. Visible, sir.
Yes. Thank you. First of all, to say, I give a thank note to Dr. Vidyadhara, from Chevrolet Hanma Institute of Pharmaceutical Sciences for inviting me and for giving me an opportunity to share my thoughts to some of the very immense, team. Generally we speak about unsung heroes. I definitely, name teachers to be an unsung heroes because, we might know that, we have lots and lots of, people who have become very famous, but behind them there is one teacher who is still being an unsung hero, doing the same job since might be for the past 50 years, 60 years, or any might be 70 years or 80 years as well. They'll be doing the same thing, but selflessly, they reciprocate all the knowledge that they gain, they upgrade themselves, they transfer all the knowledge to the people, and and they take that immense pleasure when their students reach greater heights, and when they come back and meet them one day and say that yeah, hi, I'm the CEO of this company, I'm managing a business, I've become so much famous. Still, behind them there is an unsung hero who is the teacher, who is the actual person who guided that person to be that. So that's why our ancient Sanatan Dharma also clearly specifies, classifies, after mother and father, the next place goes to a teacher, because not because they spend equal amount of time in school or college, like how much amount of time they spend on in their home, but ideally it's like what they try, what they impart, and what they transfer, and how they nurture the the next generation people when it comes. And out of this, one thing that I have come across out of my experience of, I nearly have an experience of 15 years in industry, where I managed to work with only 3 different organizations, but a very skillful organization, all including a very parent company which is an innovator company, and after that a service provider, 2 service providers where I'm working right now. But one thing that I see, where I always felt that this is somewhere we see an unsung gap which is going on. This was bothering me. Sometimes we happen to have discussions with some of the knowledgeable people of some of the institutions, and when we ask them, like, this is where we see that lacuna is there. Always what they say is that please come to please come to some forums where you address such kind of things, so that we will also come to know, because nobody is a perfectionist. But the thing is that based on the feedback that we get constantly, we try to improve our skills, and we'll try to be perfect, or at least we'll improve our skills from a zero to some level. That's what. So this is also one such forum that I have got, where specifically I have chosen this topic, because this is one of the topic where I felt that this next generation, which I'm a 90s kid, so I have a different thought process altogether when it comes to my daily practice of things in the industry. But whereas when it comes to someone who is coming into the into the industry right now, footing his steps and thinking that, yeah, I also should achieve some, I should be also a known person in the industry. What are the few things that as a teacher, or as a as a faculty, that you should imbibe or build such characteristics or traits in the upcoming budding generation people, so that they become industry ready, and they challenge themselves, they become well equipped, so that it doesn't fall as a surprise to them. Instead, they'll feel that yes, this is part and participle of the industry. So I'm not doing something new, or something which is abnormal thing, or which is an out of box kind of thing. So thanks. First of all, thanks to Dr. Vidyadhara for giving me this opportunity, and the Department of Pharmacy Practice for giving me and asking me this. And this is one such forum that where I thought, like, I should interact with all the faculty people, so that I give my thoughts where exactly the gap is building up in terms of the present generation which we are burning up. So these are from dispensing to consulting, soft skills for practice advancement. So, very to give a very short notice on why are these soft skills so essential. See, soft skills basically, you can find, if you just Google this topic, you get ends to ends and loads of information which you can imbibe from that itself. But what I'm giving from my perspective today is, the unsung gap which is being building up with the present generation. Whenever I have interaction with my kid, my kid always tells, you belong to some millennial group, we are Gen Z, Gen Beta, Gen Alpha, Gen Gamma. I don't really understand, but she keeps on educating me like, she belongs to this generation, she belongs to that generation, she belongs to this generation. But presently what I specifically see, I'm a 90s kid, where there was the education system where specifically we were given punishments. We were given good type of punishments, and specifically we were in a zone where we were at the very age era where there were very less sort of computers. When computers were evolving, communication systems were evolving, internet was evolving, sort of the availability of information was evolving. We had that beauty, we had nothing in our hands, and we were going to libraries, we were studying books, we were asking lecturers, and we were asking our teachers like this, and they used to share us information, and they used to provocate something like a question and say, try to refer this and you'll get this information. And right now we progress to a scenario where internet has become widely available, lot of content being available in YouTube, outside, blogs, writing, everyone sharing their sort of information in different platforms. But one thing that is being constantly bridging as a gap with respect to this is that the sort of information that really are the people practicing what is essential, that is what it is bridging out a lot. I see that as a very big gap. Why? Because soft skills, ideally, this is nothing but however how much knowledgeable person you are, but if you're unable to communicate that to another person, or to say that if you can't communicate what is in your mind to other person, that itself is a gap. And you can't find every time your friend to be the next person who is a listener, basically. So what you should also understand specifically is that you should always prepare for the worst scenarios ahead. The worst listener should come to you, and you should be effectively able to communicate what you're thinking about that. And with you having lots and lots of knowledge, like if you say that I have imbibed Aran Mehta completely, I know end-to-end classifications of pharmacology, I can give every side effect, I know everything from end to end. But if you don't know how to really communicate that to some person who is utterly unable to understand whatever you're going to give, it's waste. Whether it's a clinical whether it comes to clinical practice or whether it comes to an industry, when it comes to a clinical practice, basically when when a patient comes to you and you are unable to help him, that whatever knowledge you have, that really has no meaning at all, specifically. And for this I can give you an example. In when I was studying my B Farm, we used to have a subject called Kannada. We always thought like why they are giving a local language, which I'm basically from a state of Telugu, but they asked us to do a basic Kannada practice, where our syllabus was also the basic thing, that how very very basic thing. How do you communicate? How do you communicate in Kannada? Like, what is your name? How are you? How do you do this? And, the basic sort of conversational things are being taught. And that was the easiest subject. And when we used to wonder at that time, why they are teaching this, it actually makes no sense and all. But there is also a thing that is called, this is the first basic thing that has evolved in today's EMA inspection thing. First thing, if you just go to EMA inspection readiness thing and EMA legislations, which have got effective, just 2 months back, which is in the month of August or July, the first thing that they have evolved is they are asking always us to go for a risk-based approach. You should always give, a regulatory authority, or when you are starting off, anything, you should always work on the anticipated risks. And then you should give them, like, if such risks really happen, how do you evolve from that? What are the mitigation things you are readily coming, how prepared you are? You know, practicing practicing Kannada language was also similarly to that, because of which that was designed, because you can't anticipate everyone to be well versed with English. When you have a Kannada patient coming in, and whether you have a Telugu patient coming in, if you can't effectively communicate to him and say that you use this medicine in this way, this way, this way. If he asks you a question like, why should I take um, omeprazole only with empty stomach, you should be able to answer him. And if you need not communicate, you need not convince him, but the thing is that you should effectively communicate to him and say that this has to be taken in empty stomach because of so and so thing, because it controls your stomach acid, and if it has to actively exert its action, it must be taken, because it suppresses your acid to such an extent that you will feel comfortable throughout your day. If you can't communicate that, it makes no meaning. If you have that knowledge as well, if you know that pharmacological significance, if you know that pharmacy practice knowledge, but if you are unable to communicate, this is where the gap builds up. And ultimately, if you are not building up a rapport with a customer in terms of business knowledge, if you translate this to a business knowledge, if you are unable to convey your knowledge to a customer, the customer will not turn around again to you. So, ultimately you are losing a customer because you are not building up a rapport. And doing a business is always not about, selling a drug or selling a mere sort of medication to other person. It's like, how you make him a loyal customer. And for that, you need to have a good sort of conversation, emotional bonding with him, and bond. Then only, he'll keep repeatedly coming to you. If you go to rural, big grade towns as well today, many people do come, they mostly go to their known, medical shops. Why? Because it's not because of, that, they'll give some discount or anything like that. It is because they have built a bond with them. That is what, really sets them apart from, the new Apollo pharmacies which are coming in, or new MedPlus pharmacy that comes in. Until unless the person says, this is not available, please go to that, they'll not go to the other shop. Why? Because they have developed a bonding, they know how to do that, and they have really, translated their practice, and they have imbibed their skills, so that, they have attracted them to be a loyal customer. So technical skills alone do not ensure success in terms of whether clinical settings, as well as in terms of, even in the industry as well. Because whatever might be the sort of knowledge that you have in industry, using them, if you're given an opportunity to portray your skill, and if you're unable to portray your skill, and prove that you are the X factor among a group of 100 people, you're not going to get what you're desiring specifically for. Soft skills enhance the patient care, team collaboration, and career growth. And today's presentation covers the 5 key soft skill categories essential for clinical excellence. Okay, yeah. So what are these specifically? First thing is communication skills, interpersonal skills, professional attributes, and team collaboration specifically. And I'm specifically giving, first of all, one thing that I wanted to present first thing, I forgot, but, this is confidentiality. The information that I'm presenting today specifically is with respect to my views and my organization, that is Parexel, or my previous organizations where I've worked with, they have no sort of, implications to this. I'm specifically presenting my views, and these are purely my views, and my organization has no role in that. Okay. Thank you. And first thing, communication skills, the art of, basic things, how you do that, what's expecting from that? How do we use our essential 5 basic things which we use in life? Like, how do you see it? How do you listen? How do you speak? And how do you imbibe information? Everything. All this falls under this. And out of this, first thing, active listening, paying full attention to patients, colleagues, and to understand concerns. First thing that, I don't say that, I'm complaining about the present generation, but I really, not with respect to the present generation, I also say that, sometimes if when I listen to people, the attention span, specifically with respect to the present generation, it includes us as well, because we are presently in this world. In the present world, the attention span is just 10 seconds, 10 to 18 seconds. That's why, the Instagram reels are so popular enough than, a 1 minute or 2 minute, YouTube video. No one has so much patience to really understand. But, you have to be a very active listener to understand what, the other person is trying and asking from you. Without them asking you, if, for example, let's come to practice. You have a patient coming in. And let me put to a real time scenario which I have faced, in the recent scenarios. I had one of my friend, unfortunately, his father passed away. But, when his father presented, he's also a knowledgeable person. He's also a pharmacist. My friend, she's a female and she's a pharmacist, well knowledged, very well knowledged, and her husband is a software professional, and, suddenly at midnight, 2 o'clock, they have, their father-in-law turning up to their door and telling that, I have discomfort at my chest. Immediately they rushed him, to a hospital. But one thing that they did was that, they didn't really understand, the sort of emergency. He was complaining that, I'm having lots and lots of emergency and all. At that time, first thing that should come to our mind, when stress do come into, when such stressful situations do come in, everyone behaves at a very different way. But what really happened at that point of time was, my friend was very, very knowledgeable. She should have said that, let's, he's a heart patient, so, probably having an aspirin, having a nitroglycerin tablet at home would always be better. This is a sort of risk mitigation pressure, sort of thing that they should have, kept. Why? Because, already he's a heart risk patient with, 2 stents. Immediately they rushed him to a hospital. And when they rushed him to a hospital, the hospital was almost like, it is a multi-speciality hospital, which is almost like 10 kilometers from their town. Instead of going to the town, they went to an outside town. Why? Because he was previously treated there. And when they reached there, they ultimately, faced a situation where they said that, as this is a deserted hospital, though it is a multinational kind of thing, we have, we didn't still set up the emergency department to us. So we do not have any doctors to help us right now. And they had to again take them, move back to the city again, the same 10 kilometers they were traveling back. And at least they could have got some sort of help from the hospital. And when they said, this was not there, out of that panic situation, they rushed him back. And when they were rushed him back, he collapsed and he passed away. And right now they're in such a guilt situation where they could have thought that, instead of, targeting some known hospital, we should have taken to him, taken to a nearby hospital, which is like, just 2 to 3 kilometers. Why trust somewhere, where we had a previous experience? This is what, you should actively listen to the patient. If they could have really, his father-in-law was very sort of in a comforted situation. He was telling that, no, it's a very minor, he was talking fine, but, you should really understand him at that point of time. If they could have understand that this was a very sort of emergency situation, might be they could have saved him. But right now they are facing an utter guilt where, they feel that, because of us, he passed away. We didn't understand the sort of way he was telling him. We could have realized that, he was in a very urgent situation. He was telling us in a very calm situation. This is the thing. That's why, in life, listening to the other person, everyone, every one of us. And when it comes to the present situation, present department, where when I was handling training, I happened to be in a situation where I was the one who was delivering training. And every time I used to stop and ask them, like, did you understand, what you are thinking? No one used to say a question. No one used to utter a question. Specifically when, I was dealing with, a project where we had to handle 30 freshers. Those who had no knowledge of, what was pharmacovigilance, they had nothing. And, we were given a time of 30 days where specifically we had to impart them into the project. When we had to impart them into the project, and, the project was going live in 30 days. And, we have to first specifically give the project specific training. Instead of that, first thing what we have dealt was that every one of the, subject matter experts who were involved within the project, and me leading the training department, we have divided, the specific, general, guidelines. We have divided the general guidelines, like, they should understand the basics of clinical research first. What is PV? What is anticipated out of a PV? What is a safety database? What is expected from a safety database? How do you translate that when you really get an individual case safety report? How do you understand that? How do you process that? How do you transmit the information? If you have queries, whom to approach, where to approach, everything and all. And when we were speaking out them to that, very few people used to really, ask us questions like, what is this? We didn't really understand. We used to go to, we used to present screenshots so that, they can understand, because in this scenario, we can't present everything to them without a client approval, because, everything is very confidential. And when you're training a specific person, invest time, money, everything and all, everything is built to a client. So, for everything, you should get a formal approval from client. Until unless they say yes or no, we should not do that. And when we were imparting this knowledge, no one used to, really question us, do that. We also thought like, yeah, everything is going good. We went ahead, we went live with the project. And when we went live with the project, it was, a bizarre situation where, we used to have sleepless nights. We used to see the client calling us, at late nights, specifically, after our hours, telling that, we have come across so and so ICSR, it is processed with so and so bad things. And when we went back to the, to the people and asked them, like, see, this is what is specified in the general regulation, that is, general GVP guidance that is written, this is the written statement. And when it has come to your practice, this is how it translated into. Didn't you understand this? And, when we opened the specific SOP, the SOP was clearly written that, if you get so and so information, present it in this way. Did you understand this? And when we were delivering the trainings itself, we used to say very clearly out that, when you get such situation, are you understanding how to really practice that? They used to say, yeah, we understood. But really, when it translated to their work, we got lots and lots of bad feedback. And ultimately, you can't expect, a fresher to be an experienced person. And every time, the specific QC person who is, 3 to 4 years experience, 1 to 2 years experience, they coming back to us and telling that, they are not understanding what, what is written. They're not reading the SOP. They're not understanding what is given in the SOP. And we used to always go back and tell to the, the specific batch that, see, the wording that is written in an SOP is written in a very humanly language. It is not a HR language. I'm not criticizing HR department. HR language is a specific language. It is written in English, but everything, for everything, at the bottom you have 2 stars. Conditions apply. How do you infer from it? You can infer if you say that, if you read the HR language, HR language is written in such a way that if you if you assume it to be X, it becomes X. If you assume it to be Y, it becomes Y. If you assume it to be Z, it becomes Z. And when you go back and ask them, is it X, Y, or Z? They'll tell, no, it is not X, Y, Z, it is A. This is how we have written. You have misunderstood, we have written in English. That is how. That's why, HR, industry always deems, whenever we are writing anything and all, we do not anticipate them to write, sophisticated English where anything, any person would not. When specifically we are doing RCA CAPA as well, we do ask them to present in a very, very, very basic English. Why, how, when. So when an issue comes in, what we ask them specifically to write also is that, which is the next right thing, which is clear communication. We do ask them to write like, first, what's the pain point? You understand that. You actively listen what they are asking you. And after that, write it in a very precise, small language. We ask them to present in a very minimal sort of sentences, but we never ask them to write it in a sophisticated, sort of, bizarre kind of thing. You need not, use a sophisticated language. You can mention it in a simple statement mentioning that, see, when I was doing this, I anticipated that statement to be this. I thought that this statement is this, which is X, but it is not X. It is X plus 1. I was unable to understand that. That is, that is what, the industry clearly demands. We do not write our SOPs in a very sophisticated language. Always it is written in such a way that, every, very least understandable person, who doesn't know English, if they come and read it and if they try to infer from that, the inference would be a very basic thing. And we write it at a very, overview kind of thing where, not a knowledgeable person also comes and reads SOP, they'll infer that, yes, this is X, which is written there. That's all. This is what. And one thing that I felt when I was managing, almost I had people management in my 15 years of experience, almost I had 10 years of, people management, where specifically I was handling the quality, doing the RCA kappa things. And when I started managing the projects, more sort of people where I was managing their managers as well as people as well. And when I go to the people and ask them to understand, one basic thing that I always had issue with was that, whenever we try to ask them something and all, they draw very sort of, they don't try to understand what the other person is communicating. And in between, before we start giving out whatever we are feeling, they start to draw conclusions, basically because of this attention span. Very quick. They treat that, it is like doing, real life they assume that, the real life practicing situation is similar to something that they do in Instagram, which is just 30 seconds max, 30 seconds reel, or 45 seconds reel. If it is big, it is maximum 1 minute. Listening cannot go on that part. You have to actively listen, understand what the other person is telling. Then, you give your thoughts to that, what the other person has communicated clearly. Then you give out your thoughts and make them understand that. Then it becomes a good sort of conversation. And, the other person also feels to listen what you're thinking, because, you have actively listened to what he was communicating. And this is one of the things that I ask I ask the teachers to develop in them. And specifically with respect to the present situation, I don't know whether punishments are given at this point of time, but when we were not listening, when I used to study, in my organization where specifically I'm from, I take a pride to say that I studied there specifically because whenever we were, we were treated to be kids, but we were never treated to be, we were not just, forsake to, they never took us for granted. They used to respect us. They used to understand what our needs are, and then they used to punish us as well. Punishment in the sense, it is not like, go and circle around the ground for 100 rounds, anything like that. They used to give us a topic and they used to say us, now you go do your own research, come back to us, and you present it before the class, and now you understand. Then you clearly understand what the topic is. That, and when I'm trying to communicate the same thing in my class, you were not actively listening. That's why you're coming up with, so and so things. And with this fast generation, specifically this Gen Z, beta, alpha, whatever might be the thing, one thing that we should really imbibe is this listening skill. And even I also struggle to impart this to my kid. I have a daughter, and whenever I am trying to communicate the same thing to her, she'll listen halfly. Then I'll persuade her, and I can't punish her. I can't punish her. So what I'll do is that, in my own way, I'll be persuading her and telling that, see, this is the so and so thing, this is the so and so thing, this is the topic. I'll try to persuade her in a meaningful way. This is how I request you to impart the same listening skill to you, because the generation have become so faster that, before we conclude, our speaking, they start, throwing up questions. That is where, I request all sort of teachers to imbibe this part into the students. And next is clear communications, ability to explain complex medical information in understandable terms. I can say that when it comes to whether it is a clinical practice, whether it's an industrial standard, you'll be given opportunity to convey this information to someone. And if you're unable to clearly specify the same thing with a very minimal basic English, there's no use of really, imbibing or having such sort of knowledge within you. If you're unable to impart your knowledge and translate your knowledge and share your knowledge to someone, and enrich them with the same knowledge, there is no meaning of you possessing so and so much of knowledge. And it is also written in our our ancient literature that, and why I always, when with my introductory note as well, why I said that teachers are the unsung heroes or superior beings and compared next to mother and father, is basically because of this. They give their knowledge selflessly. You might have seen Satya Nadella. He's a very influential person right now, and whatever he tweets or whatever he gives, but he is also, the basic knowledge that he imbibed from, the basic knowledge about education that he has got, it is from a teacher. And I didn't research in such a way that, might be his teacher is still, sharing the same knowledge to some of the students and teaching the same 10th grade student or 8th grade student or anyone. And if you take my college itself, we have lots and lot of our, my friends, my seniors, everyone who has reached greater heights. But, our old lecturers doing the same routine job, facing new batches, giving them the same sort of education, upgrading themselves, upgrading the students as well. And they're doing that. When you're doing such selfless things, the minor gaps that, that are building up, if you tried, if you could really bridge out that, then we can see to a generation, who are, very much self-reliant to enter industry, or might be, go to clinical practice, they'll, instantly excel out. And next, written communication. And this is where I don't say that there is a problem or anything and all, but most of the times whenever I, especially I face this, while asking the root cause analysis, this is where we find we find it very difficult to understand what they have written. And it is not that they have written in English, it is because they write it in so much exaggerated level that, they don't go to the basic things. And every root cause always falls under, three basic questions. When did this happen? Why did this happen? How did this happen? That's all. These are the basic questions. If you just go to the root cause analysis, there's a, fishbone analysis, 5 why analysis. And when you go to the 5 why analysis also, the basic questions are this only. With what this did happen? When did this happen? How did this happen? How do you prevent this? That's all. These are the basic questions. And if you could really answer those basic questions in a very basic, lame way, for a basic person to understand that, if you convey that to your father, who might be an agriculturalist, and he could understand that, then, you're a very good communicator, and, you can excel at any point of time, anywhere point of time. Now the industry has evolved. Previously, I can definitely say that I had embarrassing moments whenever, especially when I was studying, when I started my B Farm somewhere, in 2004, 2005, whenever I used to go to, specifically, a practicing pharmacist, or might be, wherever with my father, everyone used to ask, what is your kid doing? And he used to say that he is studying B Farm. What is B Farm? He used to say, it is a course about medicines. Then, the first thing that they used to always say was that, shall we check for a place where, he'll establish a medical shop. That's all. From that, we have evolved to such a situation where specifically, where specifically in India, if you say that, yeah, my son did B Farm, my son did, M Farm, he's studying D Farm, people have become so much aware that they are no longer thinking that, we are just someone who is just giving the medicines. They think that, yes, we are knowledgeable person. And sometimes, I land up in such a situation that literally, after going to the industry, after practicing things and all, your knowledge which you have really imbibed from, from your books and all, everything vanishes off. And someone asked me, like, can I take this tablet with an empty stomach? First thing I'll do is that, I'll do Google. I'll search in Google, and I'll read, I'll understand, and then I'll give them a communication that, yes, you could do that. Might be, it is written that, might be you should not do that because of so and so thing. I have lots and lots of my relatives always coming up to me, previously never, they used to, oh, he's so and so person. Right now, when I go, the most common question I face in terms of when I go to any function or anywhere is that, can I take this medicine during this time? Some doctor has written this. Is it sufficient? I'm facing so and so clinical situation right now. What should I do? As you're a pharmacist, please educate me, like, how can I do this? How can I do that? In this situation, what would be the better mitigation plan for me? Every and every time I have I have a very common answer for that. I say that, first go and visit a doctor. Go and visit a good knowledgeable doctor. Make them, listen to all your concerns. Then get a diagnosis, get prescriptions. Then you ask me whether, usage of these medicines can be done in this. Is this a good branded medication? Or, we can, pass on that knowledge specifically with respect to the usage, but not like, I'm not a doctor to diagnose and tell you and give you some sort of thing. And non-verbal communication, and this is where I see a lots and lots of, if you're a practicing pharmacist, someone comes up to you, someone walks to your, walks up to you and asks you a question, son, beta, what do I'm facing so and so situation, what do you do this? Your non-verbal communication, your facial things, your professionalism should get translated in terms of, the way you speak. Not only the way you speak, the way you are looking at them. Until unless you be so much polite enough, and you need not to be, more polite enough. You have an expressionless face at least. and you speak to them, or you speak to them in a very pleasant way. Do not keep any facial expressions, thinking that if someone asks, like, please do the diagnosis, you need not say, hey, but why do you come and bother me at this point of time? You don't know, my time is very precious, you are wasting my time. You should never try to do that. Whether it might be an industrial practice as well, when someone approaches me for a query or a doubt, anything and all, and whenever someone pings me for a doubt or anything and all, I should not go them and blast them and say that, what don't you think, do you think that, when presently I'm specifically managing 18 different clients, right now, everyone, every communication that pings in, that comes to me, I have to read hundreds and hundreds of mails, and I should respond to them on a timely manner. And at that time, when someone is pinging me on urgency and asking me, like, see, brother, we have got so and so situation, can you please help me out? At that point of time, if I blast off the to them and say that, what do you think, I'm simply sitting, I don't have any other work, you go and ask so and so person, that doesn't translate. And that, firstly, that doesn't make you a good, sort of person itself. So have your non-verbal communications also set right specifically. And specifically, one good thing that we have seen is that, in Corona, most of the times, most of them do not have their cameras on whenever you're doing anything. Most of the every time, whenever we ask them to switch on their cameras, we see them, and they simply, whenever we ask a question, they simply turn off their cams, and they might be cribbing around at our back, stating that, this fellow is always targeting me, he's always asking me questions and all. But one thing, this also plays very vital role, specifically if your non-verbal communications and the way you project in front of a crowd, and whenever something comes to you, or when you are communicating the same in a group, that sets you apart in a group. So always have this as well. And next important thing, interpersonal skills specifically. So interpersonal skills, we might, mostly, these are our day-to-day routine kind of things that we, we come across, we see. But to specifically all the lecturers, you might be doing this on a regular, on your regular day-to-day activities. But one thing that I specifically find that, this is missing with the present generation is this. Specifically, first thing, empathy, understanding and sharing feelings of patients and colleagues. And as I said, right, if you're not understanding the specific feelings of another person who is communicating to you, you can't become a good human being, and you can't be a good individual as well. Not about a good individual, you can't reach, greater positions in life as well without this. Empathy doesn't mean that, when someone comes up to you or walks up to you, it's not just like, putting a chair, making him comfortable, asking him how he is, offering him, water to drink, that's not the real empathy. That might be a real empathy. But the thing is that, empathy is understanding really the feelings of other person, sharing your own feelings. And how do you present that? How do you do that? Specifically when, in industry specifically, or might be in clinical practice as well, if you're just being an individual doing everything and all, you can't achieve greater success in your life. You have to work in a group. You have to mingle with a group. And when you are specifically doing that as a group task, this is something that is very, very essential. You should understand, irrespective of the caste, creed, gender, whatever might be the thing, keep aside all the things. If you are unable to really understand the feelings of another person who is working with you, if you are a group of 10 to 15 people specifically, you can't translate that to a meaningful work. And even though you're working in, suppose you're working in a clinical practice, if you are not mingling, if you're not understanding the suffering of a patient, translate that to your practice, give him a better advice, This is how you evolve in life specifically. And one thing that I always feel that, the present generation is lacking is that, first thing, they don't try to, understand. They'll try that, his life is his, my life is mine. I'm leading my life. I have, set boundaries for that. Why should I, sacrifice my own sort of things to understand what he is feeling, then, translate some sort of thing for him. And, I'll be very professional. I'll work with him. If I say that, this is how this work should go, I'll do my X part, he'll do his Y part. Then definitely never, a project will become successful or anything. Only when they gel out with each other, they, they understand, they get a rapport with each other, they understand their feelings, they translate that to a meaningful kind of work. Then, obviously the projects will get successfully delivered. They'll earn appreciations not only for themselves but also for the team as well. And everyone will tell that, the primary pillar for this would be the manager. But, when you're managing specifically, I myself have done teaching, for a very short span of time. That's for 3 months. And, we used to, take smaller topics in terms of practicals during our masters for our B Farm students. Every time when they ask questions, right, every question that is asked is a why for us. And every time we used to, question ourselves, like, are we well sort of, knowledgeable enough to convince the other person that, this is not just convincing. It's not mere convincing that, we are imparting our knowledge to them so that they also become knowledgeable. But for that, first thing is that, the feelings that you have. And empathy is something that, I see that with the present situation, I they uh, they try to just give it a try. And if the other person might be because of any other issue, he or she doesn't translate it, they'll push it as. They do not try to actually sort of mingle with the other person, everything and all. But really, this is what, sets us apart. So, I I don't expect that, every teacher should go sit with the student and do that. But, some sort of, things, group tasks where you gel each of them so that, their, absorption techniques of the other person improves, might be in practice. You give group tasks for the kids. And right now, if you see, they are doing that in, for the primary kids as well. Because my kid, being a 5th class student, they give group tasks. And, every time they say that, they give each and every role small part for that. Like, if there is a 4 quadrant sort of diagram, they ask one person to fill it today, next person to fill it next day, next, and they have to give a group sort of, demo on, what they have done it together. Such kind of things can be done, where specifically, they start gelling up, especially I speak in terms of this conservative, kids specifically. Why? Because having nuclear families these days, most probably the kids are so reserved that, they either speak to their mother, father, and they have very small, very limited sort, very limited close intrinsic circle of friends. But if you want them to be evolving in terms of this, such sort of simple sort of exercises will really help them out. And cultural sensitivity, second thing. One thing that, specifically, you see, I'm not pointing out any person or any this thing. See, we might be from different sort of culture. I might be from a Hindu, someone is a Christian, someone is a Muslim, and I might be a, Andhra person, and the person sitting next to me might be a Bengali, or the next person sitting next to me might be a Tamilian. The next, my manager could be a Malayali, and, his manager could be a Sindhi who is from, from northern India. First thing that always comes up is that whenever the task is given to a specific person, the people who is sitting at the, at the bottom person, the bottom part, like, especially the freshers, or, the people who have really newly come to the industry. First thing that they come to them, he's a North Indian, so has given the task to a North Indian. First negative thing that, ignites in their mind, not the thing that, did we really get, at that point of time, he or she should see industry works it in, not only industry, even, education also works in such a way that, first you will try to accommodate students, then you try to analyze the students, and once you come to a good understanding that, they are capable of so and so thing, you will always challenge a person who is ready to take that, and you will not challenge a person who is not ready to take that. And if you think that, yeah, he belongs to so and so caste, he belongs to so and so state, that's why, he's getting all the things. They always fail to note this thing that, it is not because, sir has come to a conclusion that, he was testing us for this much amount of time, and he was watching us, and after watching us, he realized that, if I give this task to so and so person, he's not going to do that. That's why, they'll give at least, interesting task to them. And, a challenging task will be given, like might be a poster presentation or presentation in a different college, or might be, doing a presentation in a national symposium. Everything come, a teacher also, follows these rules and, get that. But, one thing that, this generation specifically draws a conclusion is that, they come to a very faster conclusion. And, ironically, this is practiced around us, seen around us. A very best example that I have seen just 2 days before is that Sridhar Vembu from Zoho has, created Aratai, against, WhatsApp. And, Anand Mahindra, I respect him so much because, whenever it comes to India first, always Anand Mahindra, Anand Mahindra ji, what he does is that, he projects it to the world that, India is self-reliant in doing this. And when such thing has come, today in 2 days back in LinkedIn, I have seen a post from someone. He was comparing it very logically, very neatly written. That, he was comparing WhatsApp, Aratai never can compete with the WhatsApp because WhatsApp is no longer a messenger. See, this is a sort of thing, that they always think that, we Indians are totally incapable of anything. We are just, the sheep who are just flocking around, or, we follow whatever is given to us, whatever is written, or whatever is dictated and all. Indians are no longer like that. But, people, some sort of, the people out of the culture they derive, or, out of the mentality that, they derive, they come to this faster conclusions. They always come, they are always criticizing, they are always complaining, always questioning, but that doesn't translate to a very meaningful way, or something which is in a very progressing way. It always goes in a digressing way only. And I felt, I see, reading that, I felt so much that, for the next half an hour I was really disturbed. Why? Because, Sridhar Vembu sir was not really, he was not at all challenging WhatsApp. To become self-reliant, he developed a thing. And when it is practiced in a very real way, it will evolve. And when he is evolving, writing a very good review, doing the pros and cons, that will never fetch you. And this is something, especially with respect to the cultural sensitivity, every day what we think, yeah, he is so and so, he is a so and so native, that's why this is imbibed a so and so native person, that's all. They don't, realize the thing that, first thing that they don't realize that we did never open up and tell in front of a crowd that, I am the one person who is ready to take up a task. And when it comes to a manager as well, first thing in industry also, what industry does is that it will challenge you. And when you live up to the challenge, it will give you a more better challenges. And when you live up to that as well, whatever the growth X, Y, Z that if you're anticipating yourself that, I should be an SME by the next 2 years, you will really achieve that. Why? Because you proved yourself. And for this as well, uh, um, there are lots and lots of examples that you see on your daily life. At that point of time, create a meaningful conversation with the students to make them understand that this is not because of caste, culture, creed, or might be anything that we have given so and so to so and so person. It is merely because I have done this. Why? Specifically because they draw conclusions at a very faster note. And if not a teacher or a mentor who is explaining that in a very meaningful way to them, they don't try to understand that. They have that negative sort of thing that is going on at the back of their mind, and that starts building up. That's all. And it will never help him to grow up in life as well. And teamwork specifically, and having empathy, and doing having cultural sensitivity and respecting the cultural sensitivity. And one cultural sensitivity part I can really quote as an example, specifically during the Rosa time, during the Ramzan period, specifically when Muslims do fast out, when as a team manager, when I have Muslims in around my team and all, they have to take that break. They decide to take that break, and that point of time, we never objected that. We used to share the work I used to divide the work among our team and say that, definitely he needs some time. Give him that space. It is just for 30 days. That's all. And let him gel up with the team and all. This is how you can create meaningful sort of things. And especially when we have girls doing some fastings during some of the religious time and all, you can understand that their body is built in such a way that they might be little not so much sturdy as of men, and you can't expect that from a woman, but that doesn't differentiate her from us. At that point of time, as a manager as well, we should sensitively deal that, and make the other team as well understand that she's having some sort of personal space kind of thing. Give her that. Let's do the work, and let's divide her work. And once she'll also be ready to take up the work when when such situations do come in. This is how you build up the team. You nurture the team, you pass on the legacy. Once you go up to the ladder, you pass the same legacy. Someone else from you who is working under you will become a manager. He should also pass on this, and this sort of cycle does come on. And only when you practice such interpersonal skills and you do that interpersonal connectivity, then only it translates to a very meaningful work and conflict resolution. And this is one of the very burning topic that everyone comes across in daily life. But one thing that we always do, we always go from our perspective and try to understand the problem from our perspective, and we don't think from another perspective, because it's two different individuals, not a single individual. I have my own perspective. If my thought was X, some other thought might be Y. And specifically for a people manager specifically, and especially when it comes to mentoring or tutoring or teaching specifically, these sort of situations are common in daily life. You can't criticize them all throughout the time and say that you're very bad, you're self-centric. You can't give that every time, because you also feel that I'm spreading negativity, so you don't give out those words. But I find in the specific generation, what I specifically find is that they only give their own perspective, and they don't try to listen the other. They don't try to take the problem from another's perspective. This is what I see them lacking a lot. And whenever we ask this, specifically when it comes to RCA, kappa, everything and all, did you do this? No. Why didn't you do this? He didn't communicate it to me. Was it? Then the other person will tell, I have shared a mail. He didn't read the mail. That was also an issue. Then the other person will tell that, he has sent me the mail after my working hours. Okay. The next day, did you, read the mail to, come to a conclusion of the scenario and all? No. And whenever it comes to a challenging situation, specifically in pharmacovigilance, where specifically we have ICSRs, individual case safety, reports, where, we get loads and loads of information specifically from, n number of countries, n number of people, anything that is given in social media is also pulled as an ICSR if, the 4 minimum criteria are met. And I happen to be dealing with one such case in my previous organization, Novartis, where we had a blog which was of 1100 pages blog, and in that they have discussed about one of the drug, and we had to read that 1100 pages to come to a very meaningful sense to prepare an ICSR. It's stressful. But whenever when we were doing that work as well, to one QC experienced person will be there, when the other person who is processing the part, less experienced person, they'll keep on, first they'll open the thing. First best practice that we'll do is that we'll ask them to discuss what is there. They'll try to come to a common conclusion, like we'll be pulling this information, we'll be omitting this information and all, and out of that they'll do their work and they'll translate that to a meaningful ICSR. And if they keep on just fighting that you ignore this point B, I have ignored, then the other person will come and say that you only said me to ignore this point A. This conflict never ends, and ultimately both of their days will become so much bad. And ultimately the feedback that they get also is very bad. That's why. And specifically when you're dealing with these interpersonal skills, like you're dealing with the other person's emotionals across, so try to address it from across the table. And as a guru, what I feel is that instead of the present generation never gives their ears to you, but it also becomes a problem when you are not communicating that to them or making them understand that whatever might be the thing, it differentiates you. If if it really translates to such a way that out of 100 people that you're dealing with, if 20 to even if 10 people listen and become a good individuals, or a better individuals who excel, you'll be the person who would be feeling happy, and you have that satisfaction within you, telling that yes, I've done something good for the society and for the next generation. I handled my baton to some people who are going to carry forward this, for the next, decades to come. Yeah. Coming to the next skill, professional attributes. And when we come to this, we have adaptability, time management, emotional intelligence, and resilience. First thing, adaptability, responding effectively to changing situations and priorities. See, adaptability is something, it comes out of practice, and you can't, you can't anticipate the same thing from, a fresher. So when we as a people manager, we are doing, especially when we are imbibing freshers or when we are imbibing less experienced people, first we give them a very clear, full insight, mentioning that this is how, you have to, never ever a situation is similar. Specifically in pharmacovigilance, every Friday, we anticipate that, every Friday should be a very peaceful Friday. But in turn, every Friday turns out to be a very drastic Friday. Because every day, because PV works in such a stands out such differently from other sort of things. Other departments at least will have some, at least like, if we are starting out a trial, the study startup people will have at least time to set up a project. They give a deadline, for a site activation, they give so much amount of time. But for PV, it's unlike. When it's an ICSR, when someone posts a thing in a blog somewhere in world, suppose, he posts a thing in Facebook, and, you have a person, you have a media for doing that, and you have a drug which is, clearly spoken about, and you have something like an adverse event where he is criticizing about your adverse event, mentioning that about your drug, mentioning that so and so happened because I was taking so and so, everything and all. It becomes a meaningful ICSR. It has to be captured, and we chase that with time. It has to either go as a 7-day report or 15-day report, and it doesn't really translate. You should never be in such a way that, the SOP also clearly says that the information which you are picking has to be transmitted within 24 hours. See the 24 hours deadline. And when you have the 24 hours deadline, you have a, ticking bomb, sitting next to you. And every time you should be on your toes. You should be always, working. There was, many times situations, where we used to feel that, when I was working in artist, we used to always feel that, many other department people, they used to go, they used to play in artists where we had this, table tennis, caroms, they used to have that. And, specifically drug safety team, we used to have a separate floor. And, our floor is a restricted access floor, because the information that we are dealing with should never be given to someone, or it should not, by chance or by error, move to another department, not even a paper. Specifically because, it deals with people. The protect confidentiality, plays a role in that. So, it's a restricted floor, and we are altogether treated like, different sort of world only, completely. And we used to always see and regret telling that, I have unnecessarily chosen this. But, India has become a real hub of drug safety. And to my, till this day, when I had 15 years of experience behind me, I still say that, I have a satisfaction, because somewhere with the sort of safety thing that I was doing till date, some patient at somewhere in the corner of the world would have got benefited. I have helped the medicines to get evolved in terms of their safety profile. This is what satisfaction that we define. And for that, you have to adapt to a situation. When you have, every day running, you have to adapt to situations very, which are very much demanding. I happen to quote a situation where specifically, there was one Friday, we had an audit conclusion. We had concluded the audit at 4:30. We thought that, generally for an audit report to get, shared with us, it will at least take the next 7 days. And we were prepared for that Friday. Everything was on top, everything, 4:30, the conclusion happened. 5 o'clock, our vice president was asking us, like, where would we go for, a team connect? Only just, the upper team, we have already taken, we have gone with the, with all the colleagues already, we had a connect as well. So as we have concluded audit, to stress out that, she said that, let's go to a place where, how do you prefer kind of place? And we were searching at that point of time, back end work, our regular project was going on. And at 6 o'clock, the situation turns wholly, where that night we had to really spend waking up till 3:30, including the vice president, staying up. And when we dropped messages at 3:30 that everything is sorted, then, we got a good gesture that, yes, we have done something exceptional today. I'm very proud of the team, the way you handled the situation, and you were very flexible to adapt to the situation. You excelled out at this kind of stressful situation. Thanks to one and all. That's all. Apart from that, thank you. We didn't get anything ideally, but this is how an industry, or might be a real lifetime scenario works in. However better planned we are, still a situation will throw you to you'll be thrown into a situation where you have to adapt, and you have to be you know you should show that grit at that point of time, and how much sort of pressure you are imbibing in. And when it comes to next thing is time management, balancing multiple responsibilities while maintaining a quality of care. This is this depends from person to person, really, I can say. And specifically with respect to time management, we are in such a situation, presently in the present scenario after COVID, we are in such a scenario, work from home, is a kind of BCP activity, business continuity plan. That is, if the primary plan fails, that is, everyone assembles in an office, they work for 8 hours and they deliver the work, whatever is assigned to them. That was the main thing. And work from home option was basically a business continuity plan. That's all. And I happen to recollect, when I go back to my experience previously, when I was working with multinational company, two multinational companies and this company as well, every time, in 2011, 12, 13, 14, when I started out my career, work from home was specifically a very a sort of task which is agreed upon only when you have very critical sort of thing and you are unable to do the work in office because of so and so situations. For example, is like that I had typhoid, and but I can't, I'm the workforce allocation or the team recruitment is done in such a way that you'll have backup, but the backup is not like they'll write a star in your signing document that whenever business needs, you should step into that. In a similar way, you'll not have ample amount of resources that every time once your backup once you go on leave, your backup will do. The backup will have a threshold specifically, and when that threshold exhausts, you'll need to do that. And that is where this work from home sort of thing evolved. It was a business continuity plan. Suppose somewhere the situation, supposed to say an earthquake happened, and the primary center being Philippines, for example, to say 2 to 3 days back we had earthquake, there the office communications, everything got disrupted. So the backup centers of the world, they'll be pitching in and they'll be supporting the kind of thing that is that is being done at Philippines. This is how industry works out. But right now what they do specifically, what every after COVID, COVID has translated in such a way that people are always thinking that people always think that work from home is a kind of mandate that I should take. And with the present situation, with the present sort of freshers who have come into the industry during the COVID time, because lots and lots of opportunities during the COVID time, because of, especially from the pharmaceutical sector, specifically from pharmacovigilance as well, there were lots and lots of freshers who were imbibed into the industry. And every time, what the industry also thought at that point of time was that work can be done from everywhere. And instead of asking them to come to office, what we could do is that ask them to stay at home, and instead of getting this work done at office, let them spend some more time at work, let them be flexible. And the sort of option was given to us. And when such options were given to us, the best thing that the best the best practice that you can have at that point of time is how effectively you're managing your time, especially when you're working from home or working from office. Until unless you have a very specific set of time, you imbibe, And if you can't work meaningfully for the 8 hours that you're supposed to do, you'll never give best results in your time. And one thing that I always see is that, not only with them, with myself as well, when I'm, giving this lecture as well, I have kept my phone aside as of now. But when I have my meetings, I have my phone next to me. It's for an emergency purpose. But, in this world, you can't restrict people calling you. And you have to really determine whether it is really urgent, not urgent. When you have someone calling you repeatedly, it might be an urgency, and you have to effectively manage that. And one thing that I always see lacking with respect to the present team is that, their attention gets, diverted very fast, and, they are unable to manage the time effectively for that. And one thing that they want always is that, they always want their personal time, personal space. They want to have their breaks. And whenever we ping them and ask them any sort of question, one thing they say, I went for a break just now. And the break continues on, if it's a quick 10-minute break or 15 minutes break, it's okay, chalta. But we see that we keep out an important sort of training. Especially, I had this in my training practice. Specifically, when we had this very tighter schedule, we were doing the trainings back by back, back by back, back by back. When you keep on, speaking, like in this right now, how I'm speaking right now, in a way, when I keep on delivering the SOPs and all, if I can't take smart breaks specifically, I'll get exhausted myself, and I'll exhaust their knowledge as well because of the attention span. And when we see, they'll be dropping off. And when I ask them in between questions to understand how much they understood from the SOP that I'm trying to convey to them, some of them won't reply back. And when after the training, I used to call them and ask them, I was trying to reach out to you, where were you? They'll tell that, see, I went for a break. And at that, then I said, like, I used to ask them a question like, did you understand the SOP? They used to say this. Then when I asked questions, some of them, I don't say most of them, but some of them, they had no answers. And when I question them, it's like, I had an emergency, washroom ko jana tha, washroom, I went for washroom, it's an urgency, I can't avoid, such sort of, lame excuse. But really, effectively managing time was also a very important thing, that I have seen, not happening specifically. Next comes emotional intelligence. This is where specifically I had seen people suffering out. Like, see, emotional intelligence has a very simple meaning. Understanding other person's needs and how emotionally you're dealing, your own thoughts with the other person when you work in a group, and how effectively you're translating, and how effectively you're seeing to a situation where you're emotionally strong, and how you're not letting your emotion control another person. Effectively, it is a very good trait that is looked upon for a people manager. But with the present situation, I see people take it, especially with the present generation, once you give them a feedback, they get hurt a lot, they feel a lot. And at that point of time, they try to, we I have seen such situations where they have dropped resignations as well. And when we went back and when we sat with them to understand why they always feel that the feedback that they're getting, it is always lame excuses, or QC are always points out a mistake, we are doing 95 things wrong, correct, we are not praised for those 95 things, but the 2 things that we are doing wrong, we see industry itself is works in such calibration that 99 things you do right, no one will praise you, but the one thing that you do wrongly, industry criticizes you like anything and gives a very strong feedback to you. But this is how Just a moment. Industry criticizes you for that, but this is how, industry works out. And I I happen to work under a very good individual. He was one of my best managers that I have worked upon. And the situation is that on a very Friday, it was almost like 7:30 or 8 o'clock. Our shift is coming to an end. We are almost like we are closing out for the day, and we are removing. Just suddenly we heard uh, we our department sits in a corner, and we happen to be girls saying, "Oh no!" But when you hear such screams and such out loud buster in an office, obviously you'll get attracted. So we thought like what happened, and we went there. He was our manager was sitting next to next there, and he walked out immediately and said, it was a female, she said this. And he asked him, what's the issue, any issue with respect to this, any problem you had, or any trouble, why did you scream with such a loud way? She said, oh, I got a feedback. He marked me errors and all. And he uh, that was a situation where I thought like I was wondering to see how he would deal with that. He dealt it at a very very good way, I can say. I don't say that it is a sarcastic way, but he said it in a very polite manner, telling that, see girl, he didn't write you a love letter. He just gave you a feedback. If you are so much compliant with respect to the work that you have done, go and challenge him with an SOP. And today being an Friday, that too when you're concluding the office and all, if you let this sort of negative emotion carry you throughout your weekend, you'll spoil your weekend. Why do you do that? You can deal this, you can deal with this sort of error that was marked, and he has marked that with respect to your profession and the work that you do, and he's not pointing out to you as an individual. It is your work that he's pointing out. Understand the difference, segregate the difference, go, enjoy, come back on Monday, and if you really have a basis to challenging him back to refute the error, there is a process that we can refute the error. Challenge him, and do that. I felt like that was that day we had a very good learnings. Myself, I had a very good learning scenario for me. I felt like if I could have left at least 15 minutes before, I could have never faced that situation in my life. But that's how maturely he behaved at that point of time. And the girl went, everything, she got calmed down within 2 minutes and said, okay, let me do that, let me enjoy my time for the today being Friday, I'll go home, I'll enjoy my life. And everything sorted out within. At that point of time, if he had dealt it in a different way, thinking that what the hell, why do you shout out in an office, in an office space, this is the sort of professional etiquette that you have to follow. If you would have given her back like anything and all, how could the situation be? And would the female person really continue to work in such a, she was also a very good professional, would she continue the same work going on? The situation would have been really different. This is what the sort of negative, as I said, right, with the team, with the present generation having very faster analogies and very quick determinations coming on from their part. This is how you should ask them to control their emotions, not to give out everything. And next thing is resilience. And out of this whole three situations, if you are adaptable enough, if you manage time effectively, and if you do not let your emotions translate to other person when you're working in a group, definitely you'll build resilience. Resilience is, just not about, staying calm, compose everything and all. And every time, this is what we ask from. And when you see such, in the previous example where I've said, that day when we were, we kept on working till late night, 3 o'clock, we had to ask almost like 60 people to stay along with us. We were pinning them continuously. We were sitting in an office till 12 o'clock. An admin coming to us, giving us back, telling like, this becomes, a case for us, because, you should not, sit behind so and so working hours. You please leave off to your home. But still, we went back to our home. We were working. We had 60 people supporting to us. At that point of time, you can't burst out and say to the other person, when some other person goes for a break, really at that point of time, how do you, this is what the industry demands, specifically, not only industry, at any point of time, any, in our daily life as well, such situations do demand us. And when you demonstrate your resilience, that, you're capable of doing this, everyone will tell, see how he was working at that point of time. Obviously you'll stand out in a crowd. This is what that, sets you different from a crowd. And coming to the next thing, team collaboration, specifically teamwork. And when you follow the previous two slides, this is one of the thing, specifically when you're working in a team, you should not complain about, you're not doing this, you're not doing that. They have to equally divide their work and understand that, if someone is trying to be an escapist from the work, they should never complain of doing that. Every time that you think that someone who is monitoring us is not, clearly looking into what is being done at the ground, you're mistaken. As well as your, the students or the present generation does so and so. So we see most of the escapists, whenever some group work comes into place, the escapists start, they'll do the action, but they never do that, the core type of work that is required. But the person who is really working out will stand out apart from that. And leadership, specifically guiding others and taking initiative when appropriate. I happen to give an example here where specifically, we were going live with the project which I mentioned, like we had 30 freshers and we have to test out. It was a late Friday evening that, the client, we were requesting the client that, please give us access so that, we'll test out the process. They didn't try to give us the access, because they had their own issues. And the time that we have got the access, it was late night. We have called the people we were calling all sort of the new people, and we asked them to log in. And at that point of time, the accesses were given to all the freshers and not to the people managers specifically, because it was specifically with respect to work, they had very much restrictions. Only the people who are going to work on that were given access, and all of those were it was an unfortunate situation where no experienced person was there, and all the accesses that were given were freshers. And that time we were asking people like, now go ahead, we have given you demonstrations, right? Open the database, try to work on a case. We were guiding them at back, but it was a group call where director was present, associate directors were present, project managers were present, quality managers were present, everyone present in the group. But one thing, only one girl stood up to that out of the 30 freshers and said, yeah, I'm ready to do that. And for the same person, she was given all sort of opportunities. Why? Because she stood out at that point of time. And our director, not only our director, every manager had a very positive intent on her, because she was challenging. She never complained that, I don't know anything of this and all, because we had people guiding her at the back. She stood up at that point of time. Such leadership quality should turn out. And with the same girl as well, when we had a client audit, we had an auditor coming to the floor and abruptly telling, like, who is the person who is from the intake team who is going to demonstrate me how do you manage a mailbox. And no one was, we do not have auditors asking such questions on the floor. It's once in a very blue moon scenario, means it happens because every time we have a set agenda. These are some out of box scenarios that really happen. At that point of time, she stood up and she walked out, and I happened to be the person who is guiding the auditor. I was present in the room. She explained very but she had one comfort that I was sitting next to her. She had an SME sitting next to her. Industry never throws you to an auditor. She'll be never thrown to an auditor, and they'll not have one-on-one like that. But some situations do happen. But that are once in a blue moon scenarios. I was accompanying her, so she simply demonstrated whatever she has learned to the person in a very exhaustive way. And whenever challenges did come in, she was the first person to give the challenges, and she was ready to take up. Industry does work in that manner. Not only industry, even the education kind of thing also works in such a way that only lead, you try until unless you are challenging enough to stand out in a crowd and say that I am here, this is how I'm different from other person. You can't be a leader. And mentoring specifically, what you're doing specifically right now, if the pharmacy practice department or might be the principal of Chebrul Hanumaya did not think that see, there are lots and lots of resources that are happen, lots and lots of resources in YouTube everywhere and all. They have immense amount of knowledge they can learn from themselves. This is not, they've come up with an initiative. It is a kind of mentoring kind of thing, that they want the knowledge, and some burning issue which might get unaddressed with the vast amount of that is available right now. There might be smaller gaps which might stay out to be unaddressed. They wanted to address that and translate that. They wish to translate that to a larger audience. That's why they have done that. Mentoring is also such thing, that you not only learning from your end, but also giving out the knowledge to some person. Having the knowledge completely within yourself will not fetch out. And when you impart the knowledge to some other person, and when you take the questions, when you try to evolve from that questions, you become a better individual and a better mentor as well. And this is also one of the trait that you have to really imbibe in terms of the team collaboration and all. And problem solving, specifically critical thinking, analyzing the situation objectively to make sound clinical decisions. This is not only in terms of clinical practice. You will be thrown to a hell amount of scenarios where they'll be asking n number of questions to you. But when it comes to industry, it is not just what you read from your books or what you read from your SOPs. How are you translating that to your daily work, and how meaningfully you are doing that work? When I work for PV right now, and when I deal with an ICSR, when you're working on an ICSR, then pharmacology knowledge that you do everything and all will not help you out anything, because the other person who is reporting the issue or reporting the adverse event, is a god to you. Whatever he presents, you have to capture that. That's all. And from that, when you do aggregate reports, then you apply your knowledge specifically, telling that this is a mechanism of action of the drug, and as this might translate to so and so adverse events, because this is a very known kind of thing because of so and so way of action of the drug. This is where you apply the law, your knowledge. Just reading out your SOPs, blindly following out your SOPs, many times I see, like an n+1 scenario comes, they make an error, and when we go back and ask them, like see, bacha, this is a very sort of application kind of thing. Why did you make an error? Then the thing that they'll tell is that, our SOP did not describe it very clearly. Then I see, this is not always about, what is written in SOP. See, every odd scenario will not be written out in SOP. This is, how you evolve in your work. This we commonly see in terms of the 4 to 5 years, 6 years experienced people as well. I'm really surprised to see this with the experienced people as well. Every time we go back and see, it is not because that, they don't know that, the application kind of thing, they lack that specifically. Why? Because they always think that something has to be written in book. So, something where you should really work out in terms of this is, what I ask the faculty team specifically to work out is, give them n+1 odd scenarios. Right now, if I see my kid as well, right now teaching has evolved in such a way that, they don't give homeworks from the book. They give, n+1 problems, and they try to challenge the kid in a similar way. Don't try to ever put the things which are given in a journal, or you might have come across an n+1 scenario. Create a situation out of that and give them a challenging task, so that they evolve their thinking. This is how we enrich the next generation people specifically. For this, I can say that um, uh, when I was doing my research article, 2011, at that point of time, publishing your article in a 1.5 impact factor journal itself is a very big thing. And when I was going to my guide, she is gem out of a person. And when I was working under her, I always used to think like every day was a very challenging day for me. But she never made so much things difficult for me. She used to always ask questions, basic questions: how, when, why. That's all. Only these three questions. She used to always question me these things, these three basic questions. How did you come to this conclusion? Why did you come to this conclusion? So what you're deriving from this conclusion? That's all. And when I happened to write that article, I went to her, and at the sixth time as well, when I went for reviewing the article, the article publishing for sixth time as well, I have got corrections. I thought like, Bapre, will I be able to publish the, this work really? This has been continuing on for, past 1.5 months, 2 months. But, she simply said, address these questions. So I went on, I edited the draft, I drafted the, journal for the 7th time. And when I went back to her, then she said, okay, it's good, send it for publication. Let's see what we'll hear back from that. And I was very surprised to see the feedback that I've got from the journal itself. 1.5 impact factor journals, they do not publish your research work just for that sake. And the only question that I have got from that research article was that you have specified a product. It was specifically about an animal research work, and we have mentioned that we have given food from we have feeded the rats with so and so. So what was the feed you have fed, and who manufactured it? We didn't reference that. We have referenced that we have given so and so diet to the rat, but we didn't mention from where did we procure that. That was the only thing that was questioned back to us. We didn't mention the sort of pellets that we feed to the rats, which company manufactured that. We didn't specify that. That was the only question that was questioned back. Not even the references, not even the punctuations, everything and all. And in a present world, when I go back, when I deal with when I have experience of dealing with 18 to 20 different clients and all, the most common things that we get back is you didn't the phrasing was little different. These are the sort of things. But I have adapted to this only because of the perfection that she has prepared me for. And I never felt that, writing the SOP for fifth or sixth time, I never felt bad after that. And when I've come to in the industry, when I was, new to the industry as well, when I was, every time, they don't say that. They'll tell everything in a very soft spoken way. They don't complain and say that, this fellow is not doing correctly and all. They simply write a feedback to you and mention that, see, I have, as per SOP, this has to be done. You are having so and so, so and so, so and so, sort of errors. That itself is a very good feedback on you, and that affects you. And at that point of time, why did it really happen? Because, you're not prepared for the 10+1 kind of thing scenario. Always you should prepare for that risk. And when you try to prepare for that risk, you become a perfectionist in your daily work as well. So please try to imbibe the thing of critical thinking, specifically with the present generation, because n scenario is written, it happens, but the n+1 odd scenario fetches you the X factor among the group, and you should prepare, your people for that. And creativity, finding innovative solutions. And finding innovative solutions, industry never demands this kind of thing, but when you keep on doing the same kind of work regularly, you will come across situations where you might think out, like, something. For example, I can give you an example where, in PV we get documents, large documents, 1,000 pages documents, which are just simply scanned out and sent. We have to read, analyze, and when you have to pull out information, right, you can't really pull out simple kind of thing. One tool which was already launched by, it is Adobe. Adobe has launched out a tool. If you happen to see that, we call that OCR reader. What this OCR reader specifically does is that any scanned page, any scanned copy which is there, if it is written very legibly and all, it gives out the output in Word. So simply, instead of typing out everything, right, we used to have a very difficult time during 2011, 2012, because, the world was evolving at that point of time, when we had such sort of large discharge summary simply scanned and shared with us. We used to have a very difficult time, because each ICSR would, I remember my friend working on an ICSR for 7 days. 7 days he was working on a single case, typing out each and everything, because, scanned copies were shared. He had to extract out, every meaningful scenario from the 1,000 pages thing, he was reading. And when I was trying to find solutions using Google, everything and all, I happened to come across this OCR reader. Then, I tried out that against a document. And when I tried out, we were not getting the exact copy, because, not every photo, that was a kind of AI thing which was present at that point of time. Every character that is present in that might not, the AI is not fed with so much information that, if it is yes, it might take yes as an O as well, or like a dollar symbol. It could be anything. But instead of typing the whole thing, you could get an output where you could correct small spelling errors, so that, we can do the things faster. Such kind of creative things do come out, with your daily practice. But, there are lots and lots of forums in the industry. Every time we come across, we always ask the individuals, like, from your daily work, try to find solutions, try to, come up with solutions so that, how effectively can we do that. Because efficiency is something that sponsors always expect from this. So if in PV specifically, if, the same person is doing the same ICSR kind of processing for 1 year, if they're doing, supposed to say 100 cases in an year, the client also expects that, the next year they should do 110. They, because they keep on doing the same work continuously, and this is how they should stand out. And some sort of efficiency that they build, that is what they expect. And ethical decision. this is a navigating difficult things within this the purview that you are given in. See, specifically, ethically, ethically is nothing but following regulations, following a set rule, following a kind of notion. We have to follow that. But one thing that we should also do is that we should effectively manage the time, resources, everything that we are given. And when you are having that, with the sort of rules that we have, we should play around with the rules. I don't say that you should deviate continuously from the rule. See, for example, when I have a client coming back to me asking, like, to update an SOP, for 4 to 5 studies which I'm 4 to 5 projects that I'm managing, and all of them have the same deadline, and the same SOP has to be reviewed by 4 to 5 of my counterparts. And I can't, I'm not a robot that I have 5 screens. I'll type 4 words here, 4 words here, 4 words here, this now. And someone might be some other departmental person whom I have to get the SOP reviewed from. If he or she is on leave, I should try out to ensure that that is reviewed by some person, or try to bypass that, get it reviewed by another person, next circle back to this person. I'm just being flexible enough to play within the sort of rule that is given to me. That is smartly, we call that smart work, basically. Within the given boundary to you're working within that boundary, but you're flexing it. Not that you're just you're breaking it and destructing it. Breaking itself will launch you into different problems, like RCA, kappa, everything and all, because set rules are set rules in an industry. This is within the clinical practice as well. When you try to play around the thing, and you're flexible enough to adapt to the situations, and you play around the thing and all, and you get the work done, that is how you should do. And I see the present generation, if a rule is written, every time we ask them, supposed to say, for supporting on a holiday, they'll tell that see, I also should have personal space and all. We never, we always, industry acknowledges this, that individual should have a meaningful kind of work life balance. But one thing you should also you should also be adaptable enough to think is that never ever if we say that Saturday and Sunday are not working, it's a pure holiday, it doesn't mean holiday. Sometimes you should be adaptable enough. They are, we also ask them in just to be flexible enough during that time. And they are incentivized, they are paid for those working on holidays and all. But the thing is that if you unfortunately to a situation where US has very list of very less holidays. Only they have holidays on Easter, Thanksgiving time, and during the Christmas time and New Year time. But whereas unlike India, you have lots and lots of festivals. At that point of time, you can't be in a situation where the works get hampered for continuously 2 to 3 days, that too during the weekends and all. We should be flexible enough to adapt that. And at that point of time, when we go and ask, that first thing that I see people complaining is of, should I am I bad enough to ask you to listen back that I should not enjoy my holiday? Is industry like this? But industry is always demanding. It is not giving me this is written in my sometimes such hard conversations to come in, where they say that it is written in my in my agreement that was given by the company, that I'll have Saturday and Sunday are off, and you'll have flexible, you'll have holidays, and that holidays. No, as these complaints were coming in, companies also changed their vertical and said that mandatory holidays are only national holidays, and rest all holidays are flexible holidays. And not every holiday is a holiday. They give you an open list of holidays at the start of the year to choose in, like when you will be absent, so that they do an effective planning. This is why, because the industry evolved from, the complaints that, the people were doing that. And after all this, what are the development strategies that, we expect from, the industry, the gurus to do specifically? Specifically is self-assessment to identify areas of improvement. I don't say that, hundreds and hundreds of students, which you deal with on a day-to-day life, you can't improve everyone to be, but seeing one getting improved might be, it can spark out the excitement in a next student, so as that, they will also try, like, he or she is trying to be so and so exceptional. Let us also do so. One thing that the industry never tells you is specifically, this is, as a fresher, I used to ask the same thing. Whenever I used to go to a appraisal meeting, when I was new to the appraisals kind of thing, I've got feedback. Then my manager said that, see boy, see Vijay, you're doing so and so thing. This is how you progress throughout the year, and we hear so and so things from the person who is reviewing your work. We have been monitoring you. You are doing this, you are doing that. This is how the appraisal goes on. And first thing that they do in an appraisal is, the first half will be your your acclamations, where you are so and so, you are good at so and so, you are doing this better, you're doing so and so, you have achieved so and so, this is how you have done everything and all. But the next half, which is a very important half, whatever you might think, and you might think that, oh, I am so and so superior, I have, yeah, what a superb kind of individual I am. The next half really, the next half, how you take the feedback for the next half, that really puts you apart. The next half will be so bad that, sometimes uh, I see people crying out and coming into the, they are not at all recognizing me. Whatever I have done so and so, but I have got so and so. Every time we come in, and one thing they also say is that never discuss your appraisal with someone, and never disclose whatever the appraisal that you have got with someone, because first thing that you draw easily is the negative conclusions. Not only from that, I used to always challenge my managers, the people managing, and I used to ask them, like, please, please, you show me the person who has got the highest appraisal. Why is he standing out, so that I can as well learn in from. And they used to always say, see, this is confidential, you can't expect that. You have to try to evolve that. And this is based on all the previous slides that that is how you learn, and you try to evolve. And if you ask them feedback, they'll give you a feedback on an individual kind of thing to you. But this, if you find a very good mentor and ask him that, what am I lagging in, what am I doing best in terms of my abilities, what are you expecting from me, how can I stand out, kind of thing and all, he'll give you a very meaningful way, and he'll try to work out in such a way that they'll he or she will try to give you challenges to make you excel. In a similar way, please try to do self-assessment with the kids. Specifically, I don't say kids, specifically with the with these adolescent people. They are fast enough, they draw conclusions very much faster, they're not listening. But if we could motivate out 2 to 3 students, and if it translates to 15 to 20 students out of a 50 student group, that itself is a great achievement. And soon, if it translates to different kind of years, because you have a set of people working with you for almost like 4 years, you journey with them for the whole 4 years, and we can really build sort of good individuals with good sort of behavioral things which the industry is demanding. And we can really prepare them giving them small tasks, challenges, everything, asking them to participate in symposiums to understand, what they are lagging when compared to that of different colleges, how differently the other people are doing that. This is how, we will help them to evolve. Doing self-assessment, giving them a constant feedback so that, they'll try to evolve out and excel, kind of thing. And I strongly believe that this is being done by most of you, but sadly to say, with respect to the present generation itself, I don't, whenever we try to point out them something, they take it in a very bad sense. Only first thing that comes out to them is the negative thing. And when I was when I was literally managing like 21 people during one project, where specifically my role was a project team manager. At that point of time, I can't I have to do my work, I have to give the feedback, I have to make them understand. I can't literally sit with each and every person for 30 days, the whole day and all. The maximum time I could give them is 1 hour or 2 hours. I used to pull out my personal time and used to call them and understand them and make them understand the give them a feedback and make them understand that this is how the industry works in, and this is how you should evolve. This is what you should take, and this is what you should let it go. And if that comes from the college itself, they become better individuals. And as I projected out my example itself, when my my guru, who was my mentor during my M.Pharm, the thing, the way she has built me specifically is that I stopped complaining. I used to always be in a situation where whatever comes to me, I'll simply sit, listen, do the thing. I kept on doing that. And see, when you're running off a timeline, when you have timing ticking bomb, sitting next to me, whenever client comes to me, for example, when a client comes to me with a situation and says that, boy, see Vijay, we want to get this SOP prepared within, the next 2 days. And I see, unfortunately, that one of the counterpart from whom I should get it reviewed, he's on leave. I can't go back to the client and say, sorry, I have, one of the counterpart, he's on leave. I'll be unable to deliver that. But instead of that, if I keep on doing my work and I say that, yes, the work is in progress, I complete out my thing, I get it reviewed by else except that person, and share a feedback to the client stating that, we have done so and so, but unfortunately we have one more person who was supposed to do the review, but he is on leave, so we have skipped that review for now, and we have shared it with you because this is a close tight timeline that we are working in. So share your feedback, and once we get feedback from you, I will take the feedback from the other person by the time he'll be also be coming back. Then the client will also be happy. See, the situation is the same situation, how the situation is handled, that's all. The first scenario where you start complaining about the thing and you say that things, all negative thing, and the client will also give a feedback that why did you put so and so project manager to this, to us, he's not handling the study properly, or he's not handling the situation properly, or he's not handling the project properly, please changing, because he's always complaining about the things that so and so things, within the set boundary, I'm flexing that and adapting to that situation. This is what industry expects. And for that, they, such situations also have to be given to the, students during their, learning time. And fortunately, I was very blessed to have, good sort of, professors always giving us tasks. And a very simple task, like, you ask them to take a minor topic, ask them to present in before a class. And, I can say, how confidently I'm speaking in front of a crowd. right now. So it remains the same whether I'm standing in front of a crowd and delivering the lecture, or giving it a lecture, delivering the lecture in on online, but I'm speaking to some unknown people. This is how I evolved. But this is because I was challenged by my own thing. Previously, first thing, what I used to do is that whenever I was presenting, I used to have a lot of stage fear, that I used to cough out, false cough. This is what my lecturers always used to say, that this is where you are lagging in. Try to improve, try to improve, try to improve. I started improving. I took the feedback. I've become better. I don't say that I'm best, but at least whatever I'm feeling out of my heart, I'm delivering that in a meaningful way, so that the other person could learn something from what I'm conversing. This is how I have evolved much, and this is what the industry is expecting. And if you give that smaller challenges, say, to ensure that the students are coming up well equipped, they don't hesitate to take challenges, and they will definitely excel in the industry, which is equal to an accolade from you. If we say, you can highly project your alumni and say that these people studied in our college, and ultimately it's a feather within the educational institution also. And seeking feedback from colleagues and patient. Specifically, I've written it in both meanings, that whether it is in clinical practice, or whether it might be in industry, or whether it might be in teaching as well. The simple thing that you do is that taking feedback, seeking feedback, giving feedback. Specifically, it I have written it as seeking feedback. And when it comes to a guru, it is like giving feedback. Unless you give feedback in a very meaningful way, I don't think that they do evolve. With so much faster things going on, with this fast generation, first thing that comes to their mind is negativity. You have to be so smart enough to turn that to a positive intent, how you're giving the feedback to them. And unless they take it as a positive, take it in a positive way, either they can't translate that to a positive kind of thing. They always take that to be digressing kind of thing, and they'll try to wade off. That's all. In this situation, this is what industry is expecting, that give them feedback, prepare them for the worst. And when I gave my own example, where my guru asked me to review the document for 7 times, I didn't felt bad. But it's constantly I was working on that. Then I started thinking out seeing the document in a very different way. I used to think that if I am writing this, then possibly ma'am would come out asking this question: why did you mention this? How? The basic questions. They start analyzing their own work, and they start to evolve out of their work. This is how. And formal training opportunities and workshops, this is one kind of thing that I see, is that there are lots and lots of people who are ready to deliver this, but never does opportunity really come in to them. Today, why did Chebrol Hanumaya College department and principal have thought that this thing have to be conducted? Why? Because they wanted to not just to stand out in from among the colleges, because they wanted that this small unknown gaps which are getting builded up, they wanted to minimize that, so that they become better. That is how. and arranging formal kind of trainings, from the industries, calling people from the industries, asking them to participate in, inter-college symposiums, some sort of online kind of thing. And I happen to, LinkedIn is one platform where specifically we have lots and lots of free kind of webinars. Specifically, I happen to go to a webinar where specifically the topic was AI use in medical writing. I thought specifically that they might discuss about AI, but it was very much centric to that of students. That was a free kind of thing. They have given they have shared certificates, but it was arranged by Springer Health, one of the leading organization, leading publishing house. That was a very, I thought that I never, out of enthusiasm, I thought like, I couldn't, take out that time because that was on a working day, and that too during my productive time. But I thought like, this seems to be something. Can I apply that in my kind of, daily routine? So I enrolled to that and I attended that. And when I attended that, it was so different from this. They didn't concentrate on the AI part. It was like, lots and lots of students enrolled to that, and they were asking questions like, what is the role of AI in medical writing? What sort of things can be done in medical writing? And when we are writing an article and when we are publishing an article, how does AI, pull out the sentences and all? And if, publishing house gives us feedback that you have rewritten the sentence, or you have simply copy pasted it, how effectively it is used, how effectively we can write articles using AI, how much, if as you're a publishing house, how much amount of overlapping information that you accept it out when you're trying to publish an article. Very meaningful questions, and most of them were students. And I felt very, I thought like, yes, people are literally doing this. But some of my friends, we have connects within our team where all our project managers, we sit, we discuss the progress, challenges that we are facing. It's a kind of scrum call, that we have, where we give out our challenges, we take learnings, we give out our best practices, how we are doing this and all. In such forums as well, many of them go and deliver, lectures in IPC, ISCR, in colleges. And, every time they go to colleges and all, what specifically one question that they have heard back is that, such, does a stream called pharmacovigilance really exist? What do you do in that? Because pharmacovigilance was a prior sort of just 10 to 12 was a sort of a definition for us in, say, when I was studying MPharm. It was a definition, that's all. And it was present only for 10 to 12 10 to 12 lines, where specifically pharmacon means this, vigilance means this. It is like, you have a vigilance over the adverse events, but nothing what the industry is really demanding. What do we do? How do we prepare ourselves? Everything and all. This is how you try to, without these sort of gaps getting filled out, never they become knowledgeable. And they coming to the industry, first thing, if we ask them definitions, blah 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 blah, it's not textbook definition that defines you. When we ask out, even in an interview right now, if you go and attend interviews, the person who is questioning you will expect your knowledge and will never expect a definition. And most times when I interviewed freshers as well, the most common thing that I get is a textbook definition, but never the inference from that, what they do in that really. They don't project examples. But in real world scenario, that is not the way. It works in a very different way. They try to understand how you work, what you have worked, what experience you have gained, with examples, that too meaningful examples. And next, mentoring. When it comes to mentoring specifically, it is like, it is a very innate driven, very innate driven thing, because until unless you nurture people, I have very good number of lecturers everywhere. I was fortunate enough to have, not everyone is open enough to feedback, the feedback that they get, but I have become a better person because I've listened to some person who was guiding me. And I happen to quote a situation where, one of my lecturer, he was one of a super senior who has become lecturer. I was writing my fourth year exam. When I was writing my paper, I completed my paper, and for the last 10 to 15, 20 minutes, I've completed my paper before 20 minutes. And he was going on around, he was doing the invigilation part, and he asked me, like, did you complete? I said yes. He said, okay, give me the paper. He reviewed the paper, and he didn't say anything there in the exam hall. But when I met him outside, he happened to say that, uh, you'll get distinction this time. I said, don't joke. Because I'm an average student and I'm an average performer. So, I happen to just reach out, max 70 percentage, 70 percentage was my, aggregate thing. But never did I cross, distinction is like 75 to 80. I never, reached out that. I said, like, I laughed and said, but out of his experience, he or she suggested me, like, do this, do this, do this, do this. You'll become better person, better thing. And whenever we used to get any sort of analogies, doubts, everything and all, we used to go and ask him, we are facing so and so situation. He or she was there with us. He or she, they used to guide us, and when we used to give our negative feedback to them, they used to also, reciprocate us, and they'll tell that, see, out of their experience, they used to guide us, and they used to tell us, this is how, the world works. He's giving you this feedback that is on top of your work or the knowledge that you are presenting, and that is not on you. He's not criticizing you. He's not criticizing, he's telling that, so and so areas, are the things that you are lagging in. Try to kind of develop it. Challenge the other person and try to prove that you are best in that. Try, do, read so and so, follow so and so, do so and so, and this is how you improve that. And that's how a mentoring thing will happen. And one more thing that I also see the present generation lagging is, the application kind of thing. You might possess lots and lots of language, but the application of that in a real time scenario, as I said, right, I have seen a scenario where one of my friend, he was an industrial pharmacy, M-Pharm person. And his father had to, unfortunately, because of something, he's a diabetic, and he had fasting, and they asked him to put on drip, and they simply bought dextrose and they started injecting. Then he objected that and said that, see boss, he's a sugar patient, and if you just give out the dextrose simply, it might spike his sugar so much, and it might lead to further complication for him. Go to the doctor, ask him an advice. I think at this point of time, it must be not dextrose, it is natural saline, along with sodium, that has to be administered. Please go and check back with him. And when they went back to the doctor, and the doctor suggested, yes, and asked the compounder, like, you didn't mention to me that the patient was a diabetic. It was not the fault of the doctor also, because it was never present in the case sheet. Because you can't, might be the situations come in a tighter, in a manner that, it was an emergency, they have simply called him, they have done this. But application of what you have learned is also very thing that I'm really seeing people where they're not applying what they're They say that specifically B farm and M farm people, when they're when someone is asking such kind of feedback or thing and all, try to explain them and convey them. That makes you not only a better person, but it also tests your knowledge and how much you have learned and whether you are keeping that to your daily practice or not. And I happened to be in a situation where my I had my father, we went for a function, and he had hit a wall, and his he has broken his nail, and it was bleeding so actively, the bleeding was not stopping. And everyone tell doctor, it was night 11 o'clock, and being a village, you can't expect a doctor somewhere. You might get an RMP, that's all. Apart from that, you will not get. And everyone were like panicking and all. I said, first sit down. There were no sort of I can't clean that with water. So what I did was that I asked them if they had sanitizer. I have put sanitizer, I have wiped that out with they had fortunately this first aid kit. I wiped that out, and after wiping that out, I've I have kept the cotton swab on that. I have waited for some time so that the bleeding stopped out, because my father is also a diabetic. Along with that, he was also on aspirin. So I waited for the bleeding to stop. I was stopping that with some little force, and after that I applied antiseptic cream, and fortunately I could get a clotting cream as well. First I applied the clotting cream and antiseptic cream, and did that. Then after I did this, after 15 minutes, they found out that one of their relative was a practicing surgeon. The 50th year MBBS person who was doing house surgery. They called her, and she came, and she asked me, like, what did you do? I said so and so. She said, that's good. Even then everyone was telling, no, doctor should do that, doctor should do this. Then she also said that, see, I will also do the same thing. I would have also have done the same thing. That's all. He has done it correctly. And this is where I see people not applying what they have learned in terms of daily scenarios when they come in, when it comes to real lifetime practice and all. So give such things so that at least we'll nurture the next kind of generation, mentor them, and following all these kind of things, we can prepare the students well, uh, in a way that they don't feel that coming to an industry is a burden kind of thing and all. Because most of them, they have very high expectations and on the industry, and they think that coming to an industry, working on what working on a JD that is given to them, and sort of responsibilities that are given to them, would fetch them the limelight and ensure that they reach greater heights. Industry never works in such a way. It tests you, it gives you, it will throw you to such a situation where you feel that you are in the darkest hour of your life, and then it will challenge you to find solutions and ways. And then when the the path of shine do really come in, you'll stand out in front of the crowd, and you'll reach the greater heights faster when compared to that of the other people. This is how the some sort of people do stand out. This is how successful people do stand out, and this is how we expect the the freshers to stand out. And this is where I request all the gurus as well to do that, and to practice in your daily life, so that at least we build a generation which just do not go by books, or they know how to apply the things and how to translate the things and all. Every day is a learning scenario for you, us, and them. And the more we'll prepare them for such challenging scenarios in the industry, the better they become, the the greater heights that they achieve. And it becomes a sort of a sort of feather as well, when you project out your alumni and say that so and so people are the proud alumni of so and so college. He or she is my proud student. He was a gem kind of thing and all. So, you indirectly you, you indirectly have really supported that person specifically. To conclude finally, so soft skills and technical expertise do go hand in hand. Whether it's for clinical experience or whether it might be for industrial experience, and continuous development approaches only yields better results. I can say best results. Investments with respect to investment only benefits from the patient, and the better you apply all these sort of soft skills, which you might think that will really fetch you an outstanding thing, or which will add up minor thought of minor sort of added feather to your own cap. This is how you become better, and you stand out better in the crowd, within the crowd, and you stand out. And nurturing such things specifically, especially the present generation, is very, very much essential, because the gap, I see that they're bridging out. And one thing I also see specifically with respect to the present generation is that you have to push them hard to do that. One finest scenario that I have come across is that getting an opportunity in industry itself is a very hard thing right now, and most of the companies do not prefer freshers. And whenever freshers are being pulled in, right, it's only during the emergency situations that they are not getting people, or when they have situations where they have to take out the project within 10 days. They want the people within very short span of time. At that time, they generally look out for freshers. And when you're getting that, I find surprising that sometimes I refer people, I call my friend, I do some sort of thing, share them a reference. Referral link also works in a different way, because you share that and you upload the resume in a website that throws an auto acknowledgement to the recipient, whoever might be the referee is. To them a mail goes, and within the mail there will be a link where you should fill out your information. And most of the time when we say that we have got you referred, they'll just ignore. And we also have to give feedback to these freshers that see, you'll get a link, you should open the link, you should fill out the information, submit the information. And surprisingly, we should chase them back for doing that as well, because they think that referral link, once it has come, it means that I'm into the industry. It doesn't work out. HR has a different kind of thing, and recruitment people also follow a different kind of thing. For that, every minute thing, I surprisingly get a thing that some things, sometimes whenever we have freshers getting referred by our friends, nephews, everything and all, how much we chase them back for getting referred. They ask us simple lame questions like, there's a column called PAN card. I don't have PAN card. What should I do? I really got surprised and said that, see, if you do not have PAN card, if it's not a mandatory thing, you write that I do not have a PAN card and proceed ahead and submit that. And without you submitting the information, the cycle of referral won't get completed. And with this faster kind of thing, the first every time an opportunity clicks out, it is like first come first serve kind of thing. No one is interested to go to Naukri, download profiles, because you have lots and lots of enormous amount of pool, talented pool out of this. And HR will never have such kind of patience. Instead of that, what they rely on is referral. Why? Because they want a brief set of things to be segregated from. They want their job to be very easier. This is how. But referral itself is very hectic for them, because for a simple associate role itself, they will have 100 resumes to read through. If they are rejecting a resume, they should write a comment on that, why they excluded that resume and all. When such things are there, you should be the first person to do that, so that if you had a chance to land to the interview, you are the first person to grab that opportunity. But I find lame excuses. They are asking me questions, not that it is not that they didn't ask a very but it is from their knowledge that a mandatory element will have stars and the system will not allow you to bypass. But it is a sort of application, simple application that you have to do in your life. That also I find that the present generation is unable to do. They ask, they find excuses and they say that I didn't do this because it was asking this. So this is what we have to really work on. And their life skills, especially how to interact with people around, how to live in the world. That is what I request all gurus to work upon specifically, because we have lots and lots of kids who are brought up in hostels where they have very sort of they grew up they are very conservative specifically, and if they're not being nurtured specifically with the outside world being very bad, I don't say that the world is very bad, but the thing is that if they want to survive as well, survival as well becomes a very tough situation for them, ultimately leading to all psychological issues. With this, I conclude my presentation. Hope that I have presented with whatever experience that I have possessed. So if there are any questions, I'm ready to take that. Hope I'm audible.
Yes, sir. You are audible all throughout.
Yeah.
And I'm just looking into the chat box for
Okay.
any queries by any of the delegates.
Okay.
I would come back to you in a minute. So as of now, I don't see any queries in the Q&A box. Probably you are very clear so that they don't require any questions to ask. But I personally felt that two aspects that you mentioned were very, very relatable. The first thing that I think was the shorter attention span. I think that was very, very relatable. That is what we find in on day-to-day life. It need not be a student these days, but that is the thing that is of great importance today.
Yes.
So so unfortunately we were given with very less time so that we explain our problem and expect our solutions within the short frame of time. That is very,
Yes.
very relatable. And also in a working place where you come across people with different backgrounds, the culture that they follow or the practices that they have, I think keeping them all together in one working place and still trying to get a what do you call a peaceful environment is once again a very big task that everybody should concentrate. I personally related to this
Yeah.
among all the things that you gave me because that is what I saw. So probably my audience would have related to some aspects as well.
Yes.
But again, once again, thank you so much for that elaborative talk. We were very happy to have you here. And once again, we thank you on behalf of our institute for taking part in this lecture, sir. Thank you once again.
Thank you so much, Raghu Kalyan garu, and thanks to the management of Chebrul Hanmay as well as pharmacy practice department, for giving me this opportunity to present out my thing. And I'd be always it will be my privilege to if I would be invited for such things in future as well. Thank you so much.
Sure, sir. We'll definitely have you on board the next time when we have anything regarding the student affairs or anything like that.
Yeah, sure.
Thank you, sir. So thank you all delegates for participating in this the first day. See you all tomorrow. See you all tomorrow at 11 o'clock. Thank you. And with this, we are concluding today's session.
Yeah, thank you.